My name is Christina Pease, and I am a mother of two, as well as a pediatrician practicing in South Seattle at a community health center that serves primarily low-income immigrant families. I'm going to share with you our suggestions for ensuring that children and families in Washington State are healthy and are allowed to remain healthy throughout their life. The families that I work with face incredible barriers to their physical health as well as their emotional well-being. And they also face significant barriers to opportunities in school and in life. I hope that you have had a chance to review the introductory video, which provides some helpful background on the work we have done. Throughout this, we have discussed creating good outcomes for children and families. But more specifically, we were focused on solving the inequities in our early learning system for Black, Indigenous, and people of color. The people who developed these ideas were a cross-section of parents, caregivers, early learning professionals, agency staff, and others who work with families and young children. We also conducted public outreach to over 2,000 individuals. Before providing an overview of the goals and strategies, I'd like to describe why this work is so important. It is well known that children's health and well-being is essential to their growth and development. And in general, Washington's young children are healthier than other children in other states when we look at measures, for example, such as infant mortality. The state's health insurance program for children, Apple Health, offers full health insurance at no cost for all children in low-income families, and a sliding scale for others. However, there are large disparities in the health of young children and families, and disparities that vary greatly along racial, income, and geographic lines. For example, infant mortality for Black and Native American babies is almost twice the rate for white babies in Washington State. Infant mortality rates are also much higher in some rural areas. There is a need for more infant and early childhood mental health support. When children experience trauma early in life, its impacts can last a lifetime. This has been shown in studies over and over. In addition to specific traumatic events, children are vulnerable to the significant impact of historical trauma for Black, Indigenous, and people of color. The impact of systemic racism on these children and families impacts them for a lifetime. Children with developmental delays or disabilities face significant challenges in accessing early learning services. These services are available, yet the barriers for those who need it most are often insurmountable. We need more input, awareness, and feedback on how to not just discuss what is so needed for all children, but to get down to doing the real work that will make a lasting difference. Our group first developed a broad set of goal statements to address children and family health. Goals are what we hope to be true for families and children and what we want to achieve together in the future. And then we proceeded to develop strategies that are actions we believe will accomplish those goals. Some strategies will address one goal, while others might address more than one goal. Our goals were to provide access to comprehensive health supports and provide continuity of services. Access to comprehensive health supports is crucial. Children and their families need access to a comprehensive range of health resources to achieve physical, mental, and dental health. Children's ability to learn and develop can be limited if they or their parents and caregivers are not healthy. We also must make sure that we eliminate the long-standing inequities in health outcomes for Black, Indigenous, and people of color. Our second goal, continuity of services. We have to create a system of healthcare services that weaves together the different types of health supports that are needed by children and families. That system must be racially equitable, and we also want to make sure that they are not only designed to address existing health issues, but that they provide continuous good health and supports to prevent future health issues from arising. The strategies we've discussed and developed, there are 7. First, health services and supports must be delivered based on an understanding of how historical and generational trauma caused by historic oppression of Black, Indigenous, and people of color impacts health for marginalized communities. We have to build awareness and understanding for everyone who works in the healthcare system. And this is to address our first goal, access to comprehensive health supports. Second, we have to recognize and respond to the unique fears and barriers that face immigrants in our state. Barriers such as legal status, language, and/or their need for social services. These barriers negatively impact their ability to find and receive health services. And again, this addresses the first goal of access to comprehensive health supports. Third, we want to create a system in our healthcare that provides whole person and whole family care. In other words, this is care that is centered on an individual while considering the needs and health of the whole family. We can do this by creating stronger connections between the services for medical, dental, mental health, as well as substance use disorders. We also must improve how children and families gain access to those services by addressing issues such as transportation barriers, lack of services in rural communities, and language barriers. One idea is to enable families to seek those range of services in one location, such as something we would call a healthcare hub. 4, continuity of services and eligibility. We need to identify the gaps in health services, including how rules for eligibility may limit children and families from receiving those services, and develop creative and flexible solutions to address those gaps. And this addresses our second goal of continuity of services. 5th strategy, we have to strengthen our services and supports for healthy babies and prenatal care. And this really is there to eliminate the higher rates of infant and maternal mortality for Black, Indigenous, and people of color. We also need to provide services for parents to support wellness and prevention, and in doing so, to prevent issues of abuse and neglect. And this addresses both of our goals, access to comprehensive health supports, as well as continuity of services. 6, we need to eliminate disparities in expulsions. Black, Indigenous, and children of color are expelled in early learning settings, including kindergarten through 3rd grade, at higher rates than other children. We have to provide supports and resources for children, parents, early learning professionals, and teachers to foster positive behaviors. This addresses our first goal of access to comprehensive health supports. And the last 7th strategy is that there is a great need for additional mental health services, especially in this time of the COVID pandemic. We must increase funding for additional mental health services, which will provide greater support for infants, children, families, and providers. And this goes to address our second goal of continuity of services. Thank you for your interest and time. There's so much to hope and strive for, and we can do this all together.